Will AI transform emergency telehealth diagnostics? Imagine a world where getting urgent medical help is as simple as chatting with a virtual assistant. That's the potential promise of artificial intelligence in emergency telehealth. But how close are we to making that a reality? Let's explore what's happening now and what might come next. Telehealth means providing medical care remotely through video calls, apps, or messaging. It's a great way for young people to get quick advice without leaving home. It's especially helpful for mental health support, routine checkups, and managing ongoing health issues. Telehealth can save time and money, and it makes healthcare accessible for those in remote areas or with busy schedules. But telehealth isn't perfect. It has limits, especially during emergencies. For serious issues like chest pain, severe injuries, or stroke symptoms, in-person care is often necessary. Remote diagnosis can be tricky because it relies on what patients can describe or show on camera. Sometimes symptoms are missed or misunderstood, which can delay critical treatment. That's why in emergencies, every second counts, and telehealth alone might not be enough. This is where artificial intelligence comes into play. AI can analyze symptoms, medical history, and even images like X-rays or scans much faster than humans. For example, AI systems can review a brain scan for signs of stroke and alert doctors immediately. Some hospitals have reported AI matching or exceeding human accuracy in certain diagnostic tasks, especially in spotting patterns in data that humans might overlook. AI can also guide patients through symptom checks, asking the right questions and flagging urgent cases for faster response. Chatbots and virtual assistants can provide 24-hour support, helping young people decide if they need emergency care. Wearable devices with AI can monitor vital signs like heart rate and alert users or doctors if something unusual happens, allowing early intervention. For young people, AI in emergency telehealth means more reliable ways to get help when it's needed most. An AI chatbot could walk someone through their symptoms, help them decide if it's an emergency, and connect them to a doctor quickly. If a young person uses a health app that tracks vital signs, AI could notice strange patterns and suggest seeking care before a problem worsens. AI can also reduce errors in diagnosis and make sure nothing gets overlooked. This is especially important for those who might not have much experience with healthcare. It can make emergency telehealth safer and more effective as long as humans oversee the process. Of course, AI isn't perfect. It depends on good data, and mistakes can happen. Privacy concerns and trust in machines for life-saving decisions are also important. For young people, it's vital to remember that AI tools are helpers, not replacements for professional doctors. If something feels very serious, it's always best to seek in-person emergency care. Looking ahead, AI is already making emergency telehealth faster and more accurate in many cases. For young people, this means better access to help and more tools to stay healthy. But it's essential to use these tools wisely, understand their limits, and know when to seek in-person help. As AI continues to improve, it will likely play a bigger role in emergency care, but human judgment and medical expertise will always be needed to ensure safety and proper treatment.